We are at the ACOS European Symposium in Rome, and with you for another episode of iTube Daily Coverage. With us is Dr. Luca Gualdi, who is presenting on micro-electrostimulation of ciliary muscle to restore accommodation loss in early presbyopia.
The study I present is an electrostimulation study about the ciliary muscle contraction to restore accommodation in early presbyopic eyes. As you know, every treatment for presbyopia is a surgical approach, is less or more invasive, and there are approaches on the cornea, on the lens, or on the sclera, less or more invasive with permanent effect and with the side effects, of course. And they all use pseudo-accommodation. So this study works on to restore accommodation basing on electrostimulation on the ciliary muscle. As you know, electrostimulation is already studied for physiotherapy or gynecology to restore muscle contraction. And the main issue of presbyopia, of course, is the loss of elasticity of the lens, which during the age increase its weight and its dimension. So the ciliary muscle during the 40, 50 years old start to become less powerful, and patient starting with glasses start to weaken the power of the ciliary muscle. So the issue is to restore with a passive induction of contraction based on electrostimulation the accommodation loss. The treatment is done in anesthetic drops. It lasts 8 minutes per eye, and you can do it bilaterally or monolaterally. After the treatment, the patient can see for 20 minutes like hazy, and then he can do everything in his life, and it comes with the car, no problem, and no side effects. The effect on the treatment, which is a CE mark already from more than 1 year, is not permanent, of course, like all the electrostimulation. So you have to repeat for a certain period depending on the reaction of the patient. Based on our study, we recommend to repeat the treatment in the first period at every 10 to 15 days for 4 treatments, then to wait the response and treat only once every 3 months. But depending on the reaction of the patient, for instance, patient with 40 years old, you need only 1 treatment every 4 or 5 months. If you have 49 or 50 years old, probably you need more treatment, for instance, every 2 months, depending on the reaction. So with this new treatment, the patient is in supine position. You put a contact lens, which is a rigid contact lens in polycarbonate 20 millimeters with 4 electrodes, which are connected by male-female jacks on an electrostimulator. And the treatment, which lasts 8 minutes, is very important to put the lens in a correct manner, very centered, and not to use very high frequency because the patient has not to be pain during the procedure. Normally he feels like a tingling effect, but not painful. And after the treatment, we saw the results, of course, because we studied a lot, because the patients were very happy. The most important thing is to select well the patient. If you treat the patient with between 40 and 50 years old with near correction of +1, you have 99% of result. If you start to try to correct more than 150, 25 or +150, the reaction is not very good, so it's not recommended for those patients. It's a treatment which is not in competition with other techniques because it's completely different, because it works on accommodation and not on pseudo-accommodation. And we studied the near point with a statistically significant result after 2 or 3 treatments, because the patient can see better one character, also in intermediate vision, especially for a low hyperopic patient, and also in words per minute and time, reading time. We saw that the patient is quicker response, and also we studied with the Duane test. We saw that there is a nearest point of almost 6 to 5 centimeter of near good vision. And also we studied with the UBM the accommodation, and we found that the patient in maximum accommodation increase the lens thickness, decrease the anterior part of the capsule by 0.24 millimeter in average, and 0.10 in the posterior capsule contraction. So this meant a good visual acuity for near, no loss of vision for far as the other surgical approaches, and also barometrically speaking, we saw by a barometrical study negative spherical aberration during the accommodation. So the anatomical data was also compared by the barometrical data. Regarding the safety, we didn't find any problem, only some dry eye for some minutes or days in some dry eye patients. You can restore with artificial tears, of course. And we study also about the safety, endothelial cell, no change. And with Scheimpflug camera, we studied the eventual opacification of the lens. Of course, there is no change. And also with the dysfunctional lens system, we didn't find any change on the lens opacity. So with this new treatment, is not the panacea for presbyopia, of course, but it's very interesting because it opened the fields to new studies and new surgeries that probably can restore the accommodation.